Hello, everyone. This is Brennan Hodge here, founder and CEO of CitizenHealth. And today is Health Talk number 21. We're going to be talking about Medoplex, showing off some screenshots, talking about our plans for launch here in the next 4 to 6 weeks, and just getting down to the details. So let me go ahead and share my screen with everyone, and I'll walk you through some of what we have. So you should be able to see this. This is our homepage. And let's just kind of talk about this for a little bit. What is the problem we're trying to solve? We're trying to solve a lot of problems. With this marketplace, really solving the irrational price problem, because we all know that you can go get an MRI in one city, it could be $500, go right down the street, it could be $2,700. Same thing with surgeries, could be $20,000, one facility, 3 miles away, could be $45,000. That's insane to think about that many differences. And that's like us buying a gallon of milk for $5 and then going to the next gas station. Next time we need milk and it's $25. It's irrational. And if you look at that irrational, an aggregate of those irrational prices, that equals up to about the $1 trillion that we waste every single year. And what we're trying to do is we're trying to allow people that need to pay out of pocket, and also self-funded employers that will be purchasing directly, to go to Medoplex and find exactly what they're looking for, when they're looking for, at the price point they want, and buy it directly. No insurance involved. Our target market is really people with high deductibles that are paying out of pocket already before they even reach their $5,000, $6,000, $7,000 deductible. And like I said, those self-funded employers who are just paying directly, and also people just don't have insurance. And that is me right here, and I got a good use case what I'm about to tell you. But also with just a high deductible, you start looking at what we pay just out of pocket as citizens of this country. About $400 billion is paid out of pocket. And I think it'd be wise to start being smart with how or what we're buying with that money, instead of just sending it to whoever. So that's what we got here. So the idea is I'm going to walk through it from my patient's point of view first. And if I'm here looking for a MRI, so let's just say I am coming for an MRI, and I'll just search for MRI and actually return a list. I've already walked through this. I was playing around with this earlier. Excuse me. Okay, let's just say we're searching for an MRI. And we return a list of MRIs near me. And I will say that all this is dummy data, so that no real prices, not even real names of places. And we're just throwing some in there for test purposes. When we do launch, of course, it's going to be all over the place. But here, just quickly see just the eight MRI listings we have in here. And let's just say, let's find a good one. I think MRI service has some decent stuff. Click on that. You see the services. Basically, here's a price, here's a description. There can be more information there. And what we have here is actually a messaging feature with these facilities. So if you do have a question about the MRI, you can message the facility directly, whoever's on the other side of that. You can also upload your doctor's order to the facility and transact it that way. But it's pretty straightforward. I need an MRI. I'll click purchase. Here's $376. If you're not signed in. Log in and your credit card number and pay. It's that simple. And the facility gets an email saying patient so-and-so purchased this particular MRI for this time slot, and the deal is done. Then you have to get it done. So it's a whole lot cheaper. You save a lot of money. And if you are a patient that is paying out of pocket, then this makes a whole lot of sense. And I use MRIs as an example, but we will be using, this will be open for anybody. Any healthcare provider that wants to offer their services directly, just for cash price, they'll be able to come here, create an account, and list every service and procedure product that they sell. And anybody can find them based on the value that they find important. And one thing we've been talking about is really interesting, and I really want to get everybody's feedback too on this, but looking more of, instead of just this transactional marketplace type thing, but look at it more of a eHarmony type relationship, where the patient has certain preferences that they need in a healthcare provider, and the physicians and other providers also have preferences on the patients they are better at treating, and also patients they don't want to deal with. And let's just be real here. And the idea is to match them up just like a date, just based on preferences, personality, treatment abilities, specialty areas. And as a patient is searching for a particular physician, you can actually, the physicians will be curated based on their personal preferences, and vice versa. We'll try to match up on that. And this is kind of a learning process. Something like this has never been done before, so it'll be interesting to see how it plays out. But that is, that will not be in launch when we do that, but we are working on that compatibility rating, and it's going to be interesting to see how it plays out. But in terms of what I said, the providers here, this will be open. Initially, we're going to start with the physicians, healthcare providers. And I use providers as a catch-all term. I know some people push back on that. And if you have better suggestions, please let us know. We've been talking about practitioner, clinician, but we're really looking for a catch-all term that encompasses everybody. So we'll be working on that. But the idea here is, if you basically have a solution for somebody that has a need, you'll be able to come here and create an account. Kind of already said that, and just be where your patients are, be where they're searching for, and don't worry about all the billing logistics and the invoicing and the insurance billing. A patient is going to pay you directly, and you'll be paid immediately, depending on the payout period, 24 hours to 72 hours. And then, of course, you have an awesome profile. These profiles are going to look like LinkedIn, and you'll be able to add all your credentials. I'm not saying that we're going to have a social network, but that is not out of the picture, considering that we have a big group of patients and a big group of healthcare providers coming together. It would be a good opportunity for that. But the idea here is really just to get your name out there. I know a lot of physicians, they have not necessarily struggles, but they know they want to go to this better way to practice medicine. They know they want to possibly but move to the direct primary care model. But it's that leap of faith, getting out from under all the insurance contracts, stepping out, doing your own thing, being an entrepreneur. We also want to allow this to be a place for you to come and really set up shop online, if you want to get down to it. If you might be moving to a subscription-based model of medicine, well, you're going to need some virtual patients as well to supplement building out your local subscription base. So what we want to do, we want to allow you to basically create an online persona where you can go and find those patients that you can treat the best, and they can come to you, and you can have virtual consultations with them, virtual subscriptions with them, and see how that works out. Because getting a lot of feedback that virtual is definitely the way to go, and especially asynchronous communication, where a patient can video themselves, kind of go through some questionnaires as they're being recorded and upload that. And then you, as the physician, can watch that and respond whenever you are free, instead of both parties being at the same place at the same time. I think asynchronous communication has a lot of promise. But that's the idea. And we're going for this, and it doesn't stop at physicians. I mentioned healthcare providers. We're starting to see that, seeing a lot of physical therapists, conventional care practitioners. You're seeing nutritionists, geneticists, health coaches, and this is really wide open for any type of marketplace dynamics you can imagine. And I said needs and solutions earlier. This is something I'm thinking of as a needs and solutions marketplace. So anybody that has a healthcare related need can come here and find the best possible solution for that need, and we just match them up. So that's what we're working with. Really interesting stuff, and I'm happy to see how far we've come building this. And we've been keeping this quiet too for a while, by design. So when we do release it here in the next coming weeks, we will be inviting physicians and anybody else that's listening. We're going to be inviting you. We'll be opening it up to our first beta testers. Will have free accounts, and then after that, we'll be opening it up for anybody else that wants to beta test and moving forward with that. So that's pretty much all I wanted to dig into today. Like I said, I didn't want to get into details, but I really wanted to hit a high-level overview and just leave it open for questions if anybody has any. Well, let's see here. Since nobody's saying anything, I'm just going to walk through a couple steps here, and let's just see. There are some questions popping up. Didn't see that chat, excuse me. Yes, a practice can sign up. And as a matter of fact, if we click on get started, now we're still working on this page, but we do have a way where you can sign up as an individual or an organization. So let me show you an example of where this would be. I should say, these are just different organizations. Let's look at, I think this one here. So this would be an example of a particular location, a facility. Of course, now you got your photos, you have your reviews, you can list out your services, the different providers at that location, at that facility, and then you have your schedule. Of course, if anybody's familiar with Calendly, it's kind of like that. You just say, and ZocDoc same way, you say, well, these particular dates and times I'm only open just for Medoplex bookings. And you leave that there, and that's what that schedule is. Of course, your locations. And this, the user interface here is bare bones. We will be updating this, but I want to show off the functionality of this. And of course, you have your schedule here, photos, kind of just some tabs of what I just said. I think the really one cool part would be the messaging feature. Of course, this is a bad example here, but the messaging feature where patients or members of Medoplex can message you, or I guess whoever the front desk person is, or just the physician in general can message you, and you can chat back and forth with the patient and answer questions about that. We do have bigger plans on the communication side. Instead of on top of just text-based communication, video communication, everything is secure, and you can send files or anything else that's relevant to the particular case, and keep an ongoing dialogue with that patient. So really there's a couple tools here also I need to mention that we have built. Of course, you saw scheduling. We're going to be elaborating on that. So scheduling, your communications, and also your billing, that is handled with Medoplex. So if you can just imagine how far, if we scale this out, make it where it's very user-friendly for you and for your office staff. It's really easy to use, and that's what we're trying to do, is go in there and make things as easy as possible for patients to book with you and to pay you directly. Remove out all that overhead that you got to deal with and dealing with insurance, and cut out the middleman. The prices used for price comparison. Well, there are no price comparisons. Those are actual prices. So the facility, well, of course, not what you saw there was the actual prices. But if Thompson X-Ray Center wants to say that I'm offering 4 MRIs this week for $250 each, that is their price. I mean, they set that price, and according to the terms and conditions, they will honor that price. And this is, like I said, just a marketplace. And we had something we were going to launch with, a quoting system where patients can go out there and say, you know what, I need this big surgery. I'm willing to pay $22,000 for it. Does anybody want to meet that price? Or, throw out an ask or something for a particular procedure, and have healthcare providers bid on that. So that's something, the functionality is there, just haven't done it yet. Still trying to weigh the market out, see if that's a good idea. But in terms of the prices, like I said, that is all inputted directly by the individual. Let's see, does anybody else have any questions? No? Well, if nobody else has any questions, I'm just going to kind of just scroll through here, and I guess we can end it shortly. Oh, didn't really think it's going to last over 30 minutes anyways. This works out good. All right, no more questions. Megan, John, y'all have anything to add?
Well, this is John, and I think obviously some bias is built in, but I think this is a pretty exciting opportunity for physicians and other practitioners to have access to folks that may or may not have insurance, are looking for a better way to purchase care at a better price, without narrow networks, without all the things that go along with the trappings of our overblown insurance system and healthcare system in the U.S. So yes, it's in its formative stage, but I think conceptually it makes a lot of sense. I've done healthcare service purchase both ways, and I much prefer the direct way because of a whole host of reasons. But I think, again, obvious bias, but I think what we're trying to do makes a lot of sense. For a lot of people, somewhere in the neighborhood of 24 to as high as 40 million people have no access to health insurance, whether they choose not to have it, or whether their employer doesn't offer it, or they don't qualify for subsidy under the ACA. That's an awful lot of people. And they still need access to care. This is one way to do it.
I just want to tell just a quick story about my own personal direct pricing debacles. Some of you probably heard this, but I went to see an ophthalmologist a few weeks ago, or trying to find one. And I called 4 locations. Took me 45 minutes of conversation to finally figure this out. But I think one price was $144, one was $192, one was $275, one was about $375. Big price discrepancy for just a initial consult with ophthalmologist. And of course, I didn't go with the cheap one. I didn't go with the most expensive one. I went with one in the middle. I actually had the best reviews. And that was like $190 something. And I get in there, everything's great. Well, of course, I'm paying with cash. Well, they charged me $102. She said, "Oh, since you're paying on cash, it's $102." I'm thinking, I just called and asked that, but I didn't argue at all. But what I'm getting at is just like, do people really know what they're charging for these? No, you don't really know. You don't know what the rational, true price of healthcare is. And what we're trying to do is make it all rational. This is an ambitious project, but it needs to happen, because we cannot continue doing this and expect it to get any better, because it's not. So we're doing our part, and I do think this is a good part, a good time to start collaborating together. So if any other physician, healthcare provider out there wants to be a part of this, please reach out to us and help us, and help us help you, because you can tell us what you need in your practice, what software, and we're going to build it for you. And this is a community we're all working together, really leaning towards a cooperative approach too for Medoplex, considering turning Medoplex into a freestanding cooperative where the providers can actually invest and own this and vote in the direction of it. So it definitely wouldn't be biased in. Well, possibly would by all physicians, but that's a different point. And if you are interested in that, we'll be releasing some more information out in the coming weeks. But I think that's a good model for this to really succeed. Got a few questions here to ask. We'll be promoting, like I said, I'm planning probably on middle of April to release this. Probably start onboarding healthcare providers to set up your accounts probably that first week of April, so 3 weeks from now, and start testing some things out. And as far as promoting this, good question. This is this is the plan. We got to start building up the supply side first. I mean, this is a marketplace, two-sided marketplace, so we have to build up the supply side, and that starts in April. We just start getting healthcare providers onboarded, get your account set up, and then after about 60 days of all of that, figuring out who is where, then we start a targeted marketing campaign to patients based on the particular specialties and locations that are on Medoplex. So it's not this free-for-all thing where people go in there and they really can't find somebody near them. It's not very valuable. Really want to focus on where you are at as a physician or healthcare provider, and try to bring patients to you. At the end of the day, that's what it's about, is bringing patients to you. And that's we have some unique ways of doing that, and I'll shed a little light on that. If you're familiar with Humantive, what we've been doing with Humantive, amazing application. Well, later on down the road, we're actually going to be incorporating some of Humantive into Medoplex, where the patient would go and create their patient account. They would finally get into this personal health record where they can upload their EHR records or sync with them, upload all their wearable data, their genetic, their microbiome data, and anything else that's relevant. And now you have the most comprehensive view of a person's health over time. And then from that, we're going to be serving out curated personal information, health information based on that user's particular condition. I mean, just like now you get on Facebook, you see all kind of garbage about people promoting this, this, and this. You can't trust that stuff. We really want to create an information source that's trusted and also verified by all the healthcare providers on Medoplex. That's what I was talking about, the social network side of it. I see a really good opportunity to create good information here. And I know that's kind of a big thing now, or it was a few months ago, Verify Healthcare or Verify Health hashtag of physicians on social media basically throwing out their credentials saying I'm verified or something. But really, we really see some more opportunity into having some better verification or credentialing on information sources where you can basically put your check on there and people will trust that it's from you, and then you do have some credible sources behind you. So let me see here. So is planned to allow patients to use Medit for some of these services or products? You are, yes, great question. That is exactly what this is set up for. So the whole idea behind Humantive and Medit was finally to get to Medoplex. And Medoplex is really everything we're building together. Users are incentivized to do healthy things with Medit. They get paid to do healthy things with Medit. And Medit will be used as a unit of account in Medoplex. So basically, you can use it as a discount. You can think of this as a frequent flyer miles for health. So you do healthy things and you have a bunch of providers out there that are willing to accept a 10% discount in exchange for Medit. And that's where that happens. That's just kind of, it flows around. And there's a couple of different economic models and how we could use Medit in terms of what does it actually cost the provider to list services? What are the transaction fees? And I can see some ways where we can start introducing Medit transaction fees and cost to really jumpstart the use of Medit. So let's see here. But for starters, it's 100% cash only, USD, credit card, ACH, and also considering PayPal. But I will say that for all the cryptocurrency talk in the past couple of years, a lot of payment providers have been getting very leery of that just because of all the scams out there. So definitely dealing with cryptocurrencies is not a pretty industry to be in. So I feel for everybody that's trying to make it through this. Oh, let's see here. Yeah, the clients are ready. Good question. If you have some suggestions, Brian, I would be willing to hear that. But we're thinking pretty basic, really. $200 annual membership just to be listed. $500 for extra visibility, kind of beefed up profile. Really considering the cooperative model though. Not too sure about what those price points, what the shares would be, but it would be reasonable. A few $100s, a few thousand for a share in Medoplex. And of course that would get you a one person, one vote. And of course that's a different conversation. But it's going to be reasonable. It's definitely not like ZocDoc. Was it $20,000, $30,000? Sorry, I'm not going to pay that. Oh, let's see here. So after beta, yeah, that's is it by provider organization? That's a good question. Still working through some of those details. But this really want to give this away for free. And that's kind of the idea is we want people to use this, but at the same time we got to pay developers, got to pay server costs. So it does cost. But as far as for the patient, that will be free. But depending, there's a couple other things that we will be rolling out in terms of the curated information source. I really like this idea. Something that I personally want. So there's a lot of things that can grow on top of this. All right, well, that's pretty much everything I had going on today. If there's no more questions, then I will wrap this up, and we'll get the video on YouTube. And if you have any other questions, just reach out to me. Anybody, it's Brennan at CitizenHealth.io, or you can just find us online. And I appreciate your time today. Thanks, everyone.